Looking, listening, and feeling. Those are 3 things to do when you begin performing CPR. CPR, or cardiopulmonary resuscitation, is an emergency life-saving procedure that you perform when a person's heart stops beating. It's a necessary skill that many Americans don't know how to do. Up to 70% of Americans do not know how to perform CPR and panic whenever they are put in the position to perform it. Today, I will be teaching you the steps to take before, during, and after performing CPR. I will teach you how to approach your scene, how to perform CPR, and what to do after you've successfully performed CPR. Before CPR, you need to designate someone to call 911. After you designate someone to call 911, you need to approach your victim, but make sure that the scene is safe before you approach the victim because you could harm yourself. After you approach your victim, you need to give them 2 ventilations. You tilt their chin like this and lean their head back, and then you give them 2 breaths, like breath, breath. After you do that, you look, listen, and feel for 10 seconds for a pulse or for breathing. You put your fingers on their neck like that and lean down to see if they're breathing. You do that for 10 seconds, and after the 10 seconds, if their breaths did not go in and they did not have a pulse, then you give 2 more ventilations. You continue doing this until your breaths go in. After you do that, you determine your victim's state, whether or not they have a pulse or if they're not breathing. If they have no pulse and they're not breathing, then you begin CPR. You do 30 compressions to 2 breaths for an adult and 15 to 2 for a child. You perform 100 compressions a minute, and you do like that on their chest, and you just push down for 30 times, and then after your 30 compressions are done, then you give them 2 breaths like that. You perform this for 5 cycles or 2 minutes, whichever comes first, it doesn't matter. And then after you've performed your 5 cycles, then you reassess by look, listening, and feeling for 10 more seconds. After you reassess and you've determined that they have a pulse but they are not breathing, then you begin rescue breathing. You do rescue breathing 1 breath every 5 seconds or 1 breath every 3 seconds for a child. You perform rescue breathing for 2 seconds or 2 minutes, and then you reassess them after the 2 minutes is up. After you have determined that they have a pulse and they are breathing, then you put them into the recovery position, otherwise known as the Haynes position, which is where you roll them onto their side and they put their arms like fists, and after that you monitor their level of consciousness and you wait until EMS arrives. I hope after this speech that you will now know how to perform basic CPR in case of an emergency. We have looked at the steps you take before, during, and after performing CPR and provided key points that are necessary to being able to learn how to do CPR.